day I was diagnosed with PNH and the conversation around what the treatment would be and what the decline might look like, and then when you get to that actual situation happening, maybe you aren't so confident.
My one patient, Paul, he was very reluctant to consider switching and asked me some very specific questions in terms of, in trials, how many patients were exactly like me. So it's fine to say, we took 100 patients and the majority had an improvement in their hemoglobin, but how many had aplastic anemia like me beforehand? How many, et cetera. Those are all very pointed questions, and we managed to dig out some of that information. But I think that reassured the patient most was the thought that I guess it was a question of a relationship and trust, but also a question of, if this doesn't work, the old therapy is still available to me.
Also, I didn't know if it was that bad, and so I was hesitant to maybe address or even acknowledge some of the things that were going on. And so I got blood work and my hemoglobin was at 83. So that wasn't like too much of a drastic change, but it was still lower. And then I think that conversation was the first utterance of, I don't know if you're doing too well, from my doctor. And I had a sense of relief because he said it first. I knew that, well, I can't be convincing myself that I'm not doing well because he said it first.
So you can look like you're having an excellent response to your first line treatment, and then you go off the rails. And so that's why it's important to have that ongoing dialogue with your patients, because you may not see them as often. If everything's going well and they live, hours and hours away, you may only see them in person every 6 months. The blood work's coming in intermittently, but you need to have that rapport with the patient that they say, something's not right.
I've had more recently had kind of more obvious or frank conversations. So how I'm feeling, where my head is at, does play into it, but they just have to say, well, on paper, this is what's actually happening. And that's, I guess, good, because it's a clear way to determine what's going on, but that's not what I'm feeling. There's frustration there.
Well, I think they have to learn how to complain. I think that's really important to make us understand what they're experiencing.